This is Mark Struthers, and today we will explore the biggest impact on reshaping the medical imaging field since the introduction of computers and digital imaging. Computerization in X-ray technology has been revolutionary. But for the radiologists, it has exponentially multiplied the number of images that they must analyze to make a diagnosis, and therefore the time it takes to read the data collected. With generative AI, the radiologist is given a possible scenario to compare and enhance what the radiologist thinks that the images they are interpreting represent. Generative AI exploded into the world with CHAT-GPT in 2022. Looking at the difference between generative AI compared to machine learning AI. Machine learning is getting all the possible scenarios for a diagnosis, while generative AI comes up with the answer taking the machine AI data or choices and generating what is the probable analysis or diagnosis. The radiologist uses this information to help them make the actual diagnosis. Machine learning is similar to getting input from a calculator using predictive intelligence based upon massive and continually learning databases that are being constantly refined minute by minute, increasing the accuracy of the information. Generative AI is actually using the information from machine learning to predict or analyze a specific set of facts/input. The quality of the machine learning input is crucial. The more accurate the input, the more precise the prediction or output. To begin our discussion, we must first understand what generative AI is and how it will dramatically change medical imaging practices. Generative AI is revolutionizing medical imaging by enhancing diagnostic accuracy, improving image quality, and addressing challenges like data scarcity. Here are some key applications. 1. Image synthesis. Generative models like GANs, generative adversarial networks, and VAEs, variational autoencoders, can create synthetic medical images. This is especially useful for training AI systems when real-world data is limited. 2. Image synthesis involves creating realistic images from data inputs using computational algorithms. In medical imaging, this means generating high-quality images that mimic those captured by traditional imaging modalities such as MRI, CT scans, and X-rays. The primary objective is to produce synthetic medical images that are indistinguishable from real images, providing clinicians with additional tools for diagnosis and treatment planning. 3. Image-to-image translation. These models can transform images from one modality to another, such as converting CT scans to MRI-like images, aiding in comprehensive diagnostics. 4. Super-resolution and denoising. Generative AI enhances the resolution of medical images and removes noise, making it easier for radiologists to identify anomalies. 5. Data augmentation. By generating diverse datasets, AI helps train robust diagnostic models, especially for rare diseases. 6. Radiology report generation. AI can assist in creating detailed and accurate radiology reports, saving time for healthcare professionals. Our field of choice, once widely known as X-ray and radiology, and is today medical imaging. As we look towards 2025, the landscape of medical imaging is poised for a transformative shift, largely driven by the advancements in generative artificial intelligence. This pivotal year marks a significant turning point in how medical professionals approach imaging practices, enhancing both the accuracy and efficiency of diagnoses. Generative AI technologies are set to revolutionize the way images are captured, processed, and interpreted, leading to improved patient outcomes. The integration of AI into medical imaging not only streamlines workflows but also empowers radiologists with advanced tools to analyze complex data. One of the most significant impacts of generative AI in medical imaging is the enhancement of image quality and resolution. Traditional imaging techniques often face limitations in clarity, which can hinder accurate diagnosis. However, with the application of generative AI algorithms, images can be reconstructed with unprecedented detail, allowing for more precise evaluations. This improvement not only aids radiologists in identifying subtle anomalies but also reduces the need for repeat imaging, thereby minimizing patient exposure to radiation. As we move into 2025, the expectation is that these advancements will become standard practice, fundamentally changing the way images are perceived and utilized in clinical settings. Generative AI is also set to streamline workflow efficiency within medical imaging departments. By automating routine tasks such as image sorting, labeling, and preliminary analysis, AI can significantly reduce the workload on radiologists. This allows healthcare professionals to focus more on complex cases that require human expertise. In 2025, we anticipate that AI-driven systems will be integrated into daily operations, facilitating faster turnaround times for imaging results. This efficiency not only enhances productivity but also improves patient satisfaction, as quicker diagnoses lead to timely treatment decisions. The role of generative AI in assisting diagnosis and decision-making cannot be overstated. By analyzing vast datasets, AI can identify patterns and correlations that may not be immediately apparent to human observers. This capability enables radiologists to make more informed decisions based on comprehensive data analysis. In 2025, we expect to see AI systems that provide real-time suggestions and insights during imaging evaluations, acting as a second pair of eyes for clinicians. This collaborative approach between AI and human expertise is likely to enhance diagnostic accuracy and reduce the likelihood of errors. As generative AI continues to evolve, its application in personalized medicine will become increasingly prominent. In 2025, medical imaging will not only focus on general assessments but will also cater to individual patient needs. AI algorithms can analyze a patient's unique medical history and genetic information to tailor imaging protocols that are most effective for their specific conditions. This personalized approach ensures that patients receive the most relevant and accurate imaging, leading to better targeted treatments and improved health outcomes. While the benefits of generative AI in medical imaging are substantial, it is essential to address the ethical considerations and challenges that accompany its implementation. Issues such as data privacy, algorithmic bias, and the potential for over-reliance on technology must be carefully managed. In 2025, the medical community will need to establish robust guidelines and regulations to ensure that AI is used responsibly and ethically. This includes ongoing training for healthcare professionals to understand the limitations of AI and to maintain a critical perspective on its recommendations. The integration of generative AI into medical imaging practices necessitates a shift in training and education for radiologists. As we approach 2025, educational programs will need to incorporate AI literacy, equipping future radiologists with the skills to effectively utilize these advanced technologies. This training will not only cover the technical aspects of AI but also emphasize the importance of human judgment in interpreting AI-generated insights. By fostering a collaborative mindset between AI and radiologists, we can ensure that the benefits of these technologies are fully realized in clinical practice. The rise of generative AI in medical imaging is likely to impact patient-provider relationships significantly. As AI tools enhance diagnostic accuracy and efficiency, patients may experience a greater sense of trust in their healthcare providers. In 2025, we anticipate that patients will be more informed about their imaging results, thanks to AI-driven explanations and visualizations. This transparency can foster stronger communication between patients and providers, leading to more collaborative decision-making and improved patient satisfaction. Looking ahead, the future of generative AI in medical imaging will be shaped by ongoing research and innovation. In 2025, we expect to see a surge in studies exploring new applications of AI technologies, including predictive analytics and advanced imaging techniques. Researchers will continue to investigate how AI can be leveraged to address specific challenges in medical imaging, such as early disease detection and treatment monitoring. This commitment to research will ensure that the field remains at the forefront of technological advancements, ultimately benefiting patients and healthcare providers alike. The advancement of generative AI in medical imaging will also be driven by global collaboration and knowledge sharing. In 2025, we foresee an increase in partnerships between academic institutions, healthcare organizations, and technology companies. These collaborations will facilitate the exchange of ideas, best practices, and research findings, accelerating the development and implementation of AI solutions in medical. As generative AI becomes more integrated into medical imaging, the establishment of regulatory frameworks and standards will be crucial. In 2025, we anticipate that regulatory bodies will develop guidelines to ensure the safe and effective use of AI technologies in clinical settings. These standards will address issues such as data security, algorithm validation, and the ethical use of AI in patient care. By creating a robust regulatory environment, we can foster trust in AI applications and promote their widespread adoption in medical imaging. The cost-effectiveness of generative AI in medical imaging is another critical aspect to consider. In 2025, we expect that the implementation of AI technologies will lead to significant cost savings for healthcare systems. By improving efficiency and reducing the need for repeat imaging, AI can help lower operational costs. Additionally, the enhanced accuracy of diagnoses may lead to better resource allocation and reduced treatment expenses. As healthcare providers seek to optimize their budgets, the financial benefits of AI will become increasingly appealing. Patient safety and quality of care will remain paramount as generative AI reshapes medical imaging practices. In 2025, the focus will be on ensuring that AI technologies enhance, rather than compromise, patient safety. This includes rigorous testing and validation of AI algorithms to minimize the risk of errors. By prioritizing patient safety, healthcare providers can leverage AI to improve the quality of care delivered, ultimately leading to better health outcomes for patients. The integration of generative AI into medical imaging will require interdisciplinary approaches that bring together experts from various fields. In 2025, we anticipate collaborations between radiologists, data scientists, and software engineers to develop and refine AI applications. This interdisciplinary teamwork will ensure that AI solutions are not only technically sound but also clinically relevant. By fostering collaboration across disciplines, we can create innovative AI tools that address the unique challenges of medical imaging. Public perception and acceptance of generative AI in medical imaging will play a significant role in its successful implementation. In 2025, healthcare providers will need to engage with patients and the community to address concerns and misconceptions about AI technologies. By promoting transparency and educating the public about the benefits of AI in medical imaging, we can foster a positive perception and encourage acceptance. This engagement will be essential for building trust and ensuring that patients feel comfortable with AI-assisted imaging processes. Generative AI will also play a crucial role in preventive healthcare as we move towards 2025. By analyzing imaging data alongside other health indicators, AI can help identify individuals at risk for certain conditions before symptoms arise. This proactive approach to healthcare can lead to earlier interventions and better health outcomes. As AI technologies continue to evolve, their application in preventive healthcare will become increasingly important, shifting the focus from reactive to proactive care. The integration of generative AI with other healthcare technologies will further enhance its impact on medical imaging. In 2025, we expect to see AI systems that seamlessly connect with electronic health records, telemedicine platforms, and wearable devices. This interconnectedness will enable a holistic view of patient health, allowing for more comprehensive assessments and personalized care plans. By leveraging data from multiple sources, AI can provide deeper insights into patient conditions and improve overall healthcare delivery. As the use of generative AI in medical imaging expands, challenges related to data management and security will need to be addressed. In 2025, healthcare organizations will face the task of ensuring that patient data is securely stored and managed while complying with regulations. The integration of AI technologies must prioritize data privacy and security to maintain patient trust. By implementing robust data management practices, healthcare providers can mitigate risks and protect sensitive information. The future of radiology in an AI-driven world will be characterized by collaboration between human expertise and artificial intelligence. In 2025, radiologists will increasingly rely on AI tools to enhance their practice, while also maintaining their critical role in patient care. This partnership will redefine the skill set required for radiologists, emphasizing the importance of both technical proficiency and human judgment. As we embrace this new era, the role of radiologists will evolve, focusing on interpretation, patient interaction, and decision-making. In conclusion, the impact of generative AI on medical imaging in 2025 will be profound, reshaping practices and culture within the field. As we embrace this AI revolution, it is essential to recognize the potential benefits while also addressing the challenges that lie ahead. By fostering collaboration, prioritizing patient safety, and ensuring ethical practices, we can harness the power of AI to improve medical imaging and ultimately enhance patient care. The journey towards a future where AI and human expertise coexist harmoniously is just beginning, and the possibilities are limitless. Take a moment to look at my catalog of presentations to review the historical evolution of medical imaging technology from the discovery of X-ray to informatics in medical imaging and how each milestone reached in our field has culminated in the pivotal year of 2025 being the milestone for the future of medical imaging for physicians and radiographers. Please subscribe to my channel to indicate your interest and support for my perspective. Thank you for your time. Mark Struthers, BBA BSRT, RRT, R, MRI, CIIP.